critical care specialist with Pulmonary Clinics of Southern Michigan, Dr. Anish Wadhwa. Welcome back to the show.
Good morning. Thank you for having me.
Thank you for being here.
And I think one thing, people might not know exactly what a pulmonologist or what pulmonology is. Maybe we should get that out of the way.
There are general providers that most folks see who will take care of patients and their families, top to bottom, every condition. Specialists like myself focus extra training to focus on certain diseases and organ systems. And so my fellowship training was to take care of adults who have pulmonary disease, so COPD, asthma, interstitial lung disease. And then part of our training also is specialized so that we can take care of ICU patients who are in the hospital and very sick.
Well, then COVID is right up your alley.
It has been, unfortunately, as we've talked about before, the inpatient, outpatient teamwork to take care of acute and then sometimes chronic things like COVID. It's been a big strain, but teamwork has really been the way to get through it.
What happens to your respiratory system during some COVID cases or RSV? What's going on in there?
There's a lot of different viruses that are coming around and many others which also, depending on who you are to start, can cause symptoms. We know a lot about influenza the last couple of years about COVID-19. These are acquired conditions. They may not manifest for everybody with really significant symptoms. People may just have a bit of a sniffle. But in the right person, whether it's RSV, COVID, influenza, you can really have people get really sick. And so, taking care of their chronic conditions and then trying to consider what preventive measure would be appropriate, vaccinations, et cetera, really is a way to mitigate maybe how bad things could be.
This is the time of year, and it's not this year versus any other time that the weather turns cold, people are inside more, that you see every year an uptick.
Uptake in people who come to the offices with acute symptoms, they're calling in or they present to the emergency department or they're having to go to the hospital and they're admitted. And you're right, a lot of it has to do with people are in closer contact, they're spending more time indoors, and yeah, there's more burden in the hospital, that's for sure.
Well, someone asked me, hey, do you know who that doctor is walking around with those J's on? And I said, that is Dr. Wadhwa, and good thing we have a shoe cam ready to go. Oh, yes.
Yeah.
The Jordan 1 Lows, which is it's just a classic. Have you always been a shoe guy?
I'm thinking that there's no reason not to spiff things up a bit. So this was the first foray into that. So
very good.
Trying to be hip.
I like it.
It's true. Someone was describing you to us, and the first descriptor was your shoes.
Yeah.
So you're
I was hooked.
Yeah. You gotta make an impression, a first impression, right? So.
What's as we get into this cold and winter season? I haven't heard too much out of the schools yet as far as illnesses yet, but is that something we can expect probably as we get into these colder months?
I think as the winter months come along, my kids, they were like that too when they were younger. They don't tend to wash their hands. Their snot comes out. It is what it is.
Yeah.
The stuff comes home. Maybe grandma, grandpa, mom or dad have some chronic illness, and then that's how things kind of mushroom from there. I think it's fair to anticipate that there's probably going to be more of whatever we're talking about coming in the next weeks and months.
So we'd never heard of RSV, or at least I did,
right.
Until the last year or so. But it's not new, is it?
It's not new. It was typically always something you'd associate for very young kids or adults who are immune compromised. And just like any other virus infection, it's going to manifest differently in different people. So it used to be something that we only saw really less commonly, I'd say. And I think more of the interest now is because there is a vaccine which has been developed as technology has come along. And if there's something where the risk-benefit says maybe the risk is low and the benefit is high to prevent illness, maybe that's more at the forefront now.
When should a patient come see you? What are some symptoms or some signs?
Generally, we will see patients in the office if they have chronic disease where they're oxygen dependent. Maybe they have bronchitis symptoms that are non-resolving, recurrent pneumonias. We work with primary care doctors. Most specialists who see patients chronic kidney disease, chronic heart disease, it's really a complementary relationship with the primary doctor, because the majority of the things that come up day to day, it's that other thing interacting with lung disease, diabetes, whatever it may be. But typically we're referred patients who, in their primary offices, if they're having non-resolving or persistent or worsening symptoms, and then we try to help out.
So we have all these new things we've learned to do better, wash our hands, stay away from people, quarantine, during COVID, those are all still good pieces of advice to avoid the flu or RSV.
Yeah, during COVID, there was all that thing about the hand washing and,
Yeah.
and the hand sanitizer. We still keep it in the car, with the kids, and I think it makes sense because it's small peanuts, right? It doesn't
Yeah.
take much effort to wash your hands. More significant things which got a lot of attention in terms of wearing masks and distancing. It makes sense if you're sick that you don't want to cough on somebody, right? And that doesn't have any baggage to it, the concept of maybe wearing a mask when you're sick. I think it has to be considered based on who you are, right? And the environment that you're in. If you're immune compromised, maybe those extra steps matter more.
I was at a wedding this past weekend, and all during the wedding and this reception and everything, there was this, one woman that I noticed the next day she was wearing a mask. And I thought, well, why were you not doing that during the wedding? Are you sick? But half, not even half, but some people do, some people don't. Having just partial compliance with those kinds of things, it's not going to help when you're on a plane full of people.
Different environments, the risk might be more. So I'll tell my patient that they've got to protect themselves. And so assume everybody around them could be at risk. Now, that's not a great way to live, to assume that the shoe's
Right.
going to fall. But that being said, if you're out and about just for going to the store or going out to dinner, maybe you're trying to minimize that risk where you can. And we're asking patients to do it. Nobody's telling them they have to do it. But if a patient's going to someone's going to control their own risk as much as they can, it doesn't mean don't go out of the house. It means maybe wash your hands before you hold the grocery cart or something like that.
You could have washed your hands when we were in Disney World last year, and we wouldn't have had that incident. Do you want to tell
No.
Dr. Wadhwa about that?
No, I think I had rotavirus.
We had to leave him in Disney World. We had to fly home without him. He was so sick.
It was awful.
I'm so sorry. That is not the happiest place on earth for you.
It was not, trust me.
No, it wasn't the happiest place in the world. Up until that time it was.
Yeah, it was.
You
yeah.
still got a bill.
Oh,
A
yeah.
big bill.
Oh, yeah. Yeah. Oh, yes, I did. Yeah.
Oh, well,
But you think you got sick from someone not washing their hands and touching your food, and you swear by that. Yep.
I can picture the waiter with his thumb on my plate. and I don't think you all got the thumb.
Well, I didn't. No,
See?
clearly we didn't.
Common things are common, right? And so if you wear oxygen, or you have some chronic condition, or maybe 3 or 4 different things, and you've had difficulties, asking everybody to wash their hands when they're around you, it's a bit of an ask, but maybe it might help. And it may not be that it leads to severe illness if you get sick, but maybe you feel crappy for 3 or 4 or 5 weeks, and that really sets you back in terms of other things you want to do.
You make a big production of washing your own hands so that people fall in line and do it as well.
Best
Right.
practice to
Yeah.
show,
Yeah.
yeah.
And it's really, I think even your iPhone and your watch, they'll even time out the proper length of hand washing
Really.
that you need to do.
I think it's
Yes.
a full Happy Birthday to You song.
Twice.
Oh, twice?
The Jeopardy theme
Okay.
song. Thinking music.
Perfect.
Well, thanks for all that you do for all the people in our community, and thanks for coming in today.
Appreciate it. For folks who have a question, talk to your primary doctor. That's always the first step to see where you need to go.
Great. Thank you, Doctor.
Thanks.
Dr. Anish Wadhwa from the Pulmonary Clinics of Southern Michigan. An anniversary is being celebrated this weekend. We'll hear all about it coming up next.